Okay, and just one comment before we get started. This meeting is being recorded and will be posted to YouTube on the commission page. That is not something that's new, but they're asking now that we make that announcement at the beginning of the meeting. So please, when you're making your comments, don't say anything that you don't want to be published out on YouTube, okay? There's my disclaimer.
So we're done with the public comment?
We are. Yes.
All right, now, next we have our favorite delegate in the House of Delegates.
Thank you so much. We had a pretty eventful session. I know me personally, I was 2 months postpartum when we started the legislative session down in Richmond. So had to kind of pick up everything, including my newborn baby girl, and go down to Richmond. And this was the 45-day session in the odd year. So we had a number of different things happen. We had 915 bills passed the General Assembly after hearing thousands of bills in the subcommittees on the committee. I currently serve on the General Laws Committee, the Transportation Committee, and the Public Safety Committee, including 6 subcommittees, including the Firearms Subcommittee. And then in the off season, I serve on the growing Public Transit Needs Committee, which actually meets tomorrow in Vienna. And then I serve on the Addiction and Recovery Council, the Behavioral Health Commission, and the Housing Commission. So pretty busy in the off season as well. So again, this session, we had about 915 bills passed. We had the governor sign 599 of those bills into law, and then he amended 159 bills and vetoed 157 bills. And so that included a couple of my bills. So what I'll do is I'll go through a couple bills that I carried that may be of interest to the commission, and then I will go over a list of bills that impact seniors and folks aging in place in the Commonwealth of Virginia. And the other thing that the governor did was he handed down up to, I think it's, I don't remember the exact number, but it was hovering around 200 line amendments in the budget. And I know a lot of the senior budget items by him, but then the General Assembly rejected a number, probably actually a majority of his amendments, including my child care amendment that would create our child care funding that would create a public-private partnership between employers who want to give money to their employees for child care, and then there would be a state match. The governor tried to eliminate that funding and we rejected that. So I'll go through again a number of different things that I carried and then that we carried overall as a caucus. And so I had about 13 bills of my 13 of my bills passed the General Assembly, including one resolution, which actually made me have the highest bill passage rate in House of Delegates, which was very validating when you have a baby. And so I carried a number of different bills on what we call the Omnibus Bill. And it's a number of bills that impact maternal health. And so those things passed, and then I have I waived some fees for homeless youth related to obtaining vital records. I know that's a major barrier for a lot of youth in our community who are trying to kind of move on to the next step. It's rough to get access to those documents when there's fees attached. The other thing is, I know a big priority to the commission is eviction diversion. And so my bill actually expanded the eviction diversion program, made it permanent, and then expanded it to localities across the Commonwealth who want to participate. Prior to that, it was a pilot program, and it was only offered in about 3 to 4 cities around the Commonwealth. Now it's open to any locality who wants to participate, and it's permanent. The other thing is renter related, requires landlords to give 60 days written notice prior to informing a tenant that they're not going to renew their lease. That was not law before, but 60 days I think is the very least that a landlord can do if they plan to not renew the lease. They should at least let the tenant know that in advance. So especially in a place like Arlington where we have very low vacancy rates, and you need time to find that next place that you can live. The other one that got passed is related to junk fees. So my bill would ban hidden junk fees. When you're checking out at a hotel, when you have a live ticketing event that you're purchasing online, when it comes to rental fees, literally anything and it applies to any company that provides a good or a service in the Commonwealth, it would ban them from hiding those fees and require them to disclose them up front and make them more transparent. And we want to reward those businesses that are very transparent already by making sure that their counterparts are required by law to be transparent as well, and thus more competitive. And less likely to pass on some random hidden fee, if people know about it up front. So, everybody knows the opportunity cost of time. When you're checking out and you think that you're about to pay $50 for something, when you're about to pay literally anything, if you're getting groceries delivered, food, anything, and then you get to the end of the cart and it's $80 and you have no idea how that happened, and you look at the small print and the fees, there's some random fees tacked on. And so my bill would require them to display up front, here are the fees before you even purchase anything, which will give you more consumer information and say, you know what, I don't want to purchase anything from them. I'm going to go to the competitor because I see up front, and I'm not going to waste my time on those fees. So that transparency really gives more consumer power. The governor did amend that bill to create an exception for health clubs, which I think, many times health clubs are some of the biggest offenders of hidden junk fees. So I rejected that amendment. And then he also put in an amendment to put in a reenactment clause, which means the bill's not law unless I bring it back next year. And that essentially to me means it's dead. So you have to pass it twice in order for it to be law, and that doesn't make any sense. So I rejected that as well. So now the ball's back in his court to take action. He has to take action on any of these amendments. Either veto them, let them become law, or sign them into law by May 2nd. So he has about 30 days. By the way, we went back on April 2nd, which happened to also be my birthday, our veto session. And that's when we took action as a General Assembly on all of the governor's actions, which he had to get to us by a midnight deadline. And it was, all those amendments that I mentioned on the budget and on a number of different bills that we did ask. There were several bills where we asked to override the veto, including my bill related to domestic violence and gun violence prevention. I think I mentioned this to you all last year. I carried it last year. There is a bill that I've been carrying that would close the dating partner loophole. And right now in Virginia, if you are married or have a child with someone who is a convicted abuser, they are not allowed to possess a gun unless you are unmarried. If you're unmarried, the law says there's a loophole and you don't deserve to be protected from your convicted abuser, and they can possess a gun. So my very important bill would, it's very critical to close that loophole, and the governor vetoed it twice, which, I refer to as a deadly veto. There are a number of people who are going to continue to be unprotected under our code as it currently is written. And then on to another bill that I got passed. It's a kind of a cleanup bill that clarifies a couple of things that allows unlicensed property managers to sign leases, which streamlines the leasing process so they don't have to have a licensed realtor kind of in place in order to sign that lease. So it's just a cleanup bill that explicitly states that authority so that those landlord documents and leases are more streamlined for tenants to get into place. And then I have a resolution that designates May as ALS Awareness Month, which I thought was extremely important to folks who are deeply impacted by ALS and whose family members are impacted by it as well, to raise awareness and to establish that time for the family in the month of May in the Commonwealth of Virginia. And then that's for the bills that I specifically carried. Like I said, there's 13. I know I have a fun one in there where the Washington Commanders approached me with a bill and asked if they have to have authority to design a new license plate to include the new name and logo. So I agreed to carry that, and there was a little bit of fun with it on the floor. Our speaker happens to be a Cowboys fan. So a couple people voted no on that, as fun, I guess. But you'll start to see some of those license plates kind of shown around. I think, July 1st is when that would go, into effect, and then they start designing the license plate. And so that's it for my bills, and we'll send out, I have a sheet here, we'll send out, my handout that has every bill listed, and then, some additional information. And then if you happen to live in the second district, we have our newsletter going out. We have a number of things that we detail in there as well. So I mentioned the childcare bill. So the childcare bill that I carried, came with, I secured 25 million in the budget for that initiative. Again, it creates a public-private partnership and creates a state match with that employer who wants to engage in this pilot program. And it's helped to make childcare more affordable for our workforce. And then I co-patron 3 constitutional amendments. The first to, safeguard our reproductive health rights. And then the second one, automatic restoration of voting rights for those who have served their time. And then the other one is the fundamental right to marriage equality. So those three constitutional amendments do not need the governor. And they just need to pass the General Assembly again next year. And then they go to the ballot for the referendum for the voters to decide on those 3 constitutional amendments. And so that's it for my bills. And then in terms of the legislative accomplishments that we got passed benefiting those aging in place, we have a couple different bills. And, please stop me if you want the bill number. I can also send this list. But if you want the bill number, you can dig more into the specifics on the bill. And then also on the legislative website, so lis.virginia.gov, you can also watch all of the hearings related to these bills, so you can hear the discussion and how the code kind of got written the way it did and how that bill ended up in that posture before the governor signed it. So it literally has everything. I'm very thankful for that system because you can kind of go back and get reminded why certain things ended up in the code. So one bill is to prohibit out-of-pocket costs for diagnostic secondary breast cancer screenings. And then there also was a clarification made to the real property tax exemption for elderly and disabled individuals, improving financial security. And so this bill amended the code to basically expand eligibility to more folks when it comes to property tax exemption. And then we also expanded eligibility for the Virginia Values Veterans Program to ensure veterans and their families receive support that they deserve. And then we also implemented stronger oversight for nursing homes. And then another bill requiring annual open enrollment periods for Medicaid supplement policies to give more flexibility for coverage. And then another bill allow electronic monitoring in resident rooms at nursing facilities. One bill that we tried to get passed year after year is paid family and medical leave for working Virginians. That was unfortunately vetoed by the governor. The other one that I thought was extremely important, and I think really life-saving and really impacts a lot of people, is establishing the Prescription Drug Affordability Board so that they can look at those drug costs and lower them for folks across Commonwealth. Fortunately, that was vetoed again. But we'll continue to bring that back. We think it's extremely important. Another bill that we got passed, Delegate Mark Sickles carried a bill requiring insurance companies to cover mental health treatment. And then we have one that would have strengthened employee protections from wage abuse, and that one was vetoed by the governor as well. And then on to some budget amendments. We have some budget amendments that were approved by the General Assembly that were aimed at expanding services for our aging population. $750,000 for local agencies on aging. And then we have $300,000 for Centers for Independent Living to provide independent living skills training. And then $400,000 to fund pilot programs supporting individuals with dementia or those at risk of being placed in state facilities. And then 8.7 million increase for community services boards to fund support coordinators to help individuals and families identify and link to services and resources. So those are just a few of the highlights. I know that, again, the governor tried to eliminate a lot of that funding and we rejected that. the General Assembly. And this is what we like to call the caboose budget. So it's, the tail end of the budget that we've already passed last year. We made a number of amendments to this year. And so we'll see kind of where we go on that. We put the ball back in the governor's court. We'll see what he does, on the budget and, whether or not we get some of those things in. But, next year we will have a new governor. And so we'll see what that governor's priorities look like when it comes to, the priorities that we submitted as a General Assembly on a pretty wide bipartisan basis, this session. And so that's just a few of the highlights and overall update from, the General Assembly side. And, I do anticipate speaking on, something that I know is on top of everybody's minds. I do anticipate a special session dealing with the federal workforce reductions and, the funding reductions that I know people are rightfully so, very, very worried about, especially when it comes to Medicaid or any other services and programs that we get a significant amount of federal funding for. So we have the speaker put together an emergency committee dealing with those workforce reductions and those funding reductions. And it's a bipartisan committee. They've met twice so far. They were up at the Virginia Tech Innovation Campus. And right now what they're doing is kind of a state of the Commonwealth to see where we are, and then in anticipation of what could be coming down the pike, cascading down from Washington, D.C. And next, they're going to go to Southwest Virginia, and they're asking a lot of people to submit public comment for action ideas, anything that they may be hearing or experiencing. You can submit public comment online to this particular committee ahead of this upcoming meeting or the meeting after that. And then they'll be coming up with a set of recommendations or recommended actions as things are happening in DC, because we hear a lot of what could happen. Of course, we haven't had anything concrete yet when it comes to funding reductions. But in terms of the federal workforce, I know I and a number of my colleagues have a section on our website that provides a lot of services and resources for federal workers. If you are or know of any folks who need help, and to reach out to myself or their representative when it comes to navigating the unemployment system in Virginia. So with that, I'm happy to take any questions.
All right, thank you so much, Adele. Do we have any questions for Adele? Yes, sir.
Morning. This question is not really related to a lot of the things that you talked about, but there was a governance bill that was passed and by both houses, and two questions. One is, do you know why the governor vetoed it? And two, do you know why the Senate put an enactment provision in that bill?
So great question. You're talking about Patrick Hope's bill?
Yeah.
So Delegate Patrick Hope had that governance bill, that I chief co-patron, that would have allowed Arlington to change its form of government and the way it operates. So restoring authority to the localities for how they govern themselves. And so I personally deeply believed in restoring a lot of locality authority or local authority. So that's why I supported it. In terms of why the Senate put a reenactment on it, it may be, I'm not in the Senate, so I can't exactly give a reason. Maybe they thought that there needed to be more discussion. I'm not exactly sure on that part, but that would have been my educated guess in terms of me knowing the Senate. And then the governor provided, so every time the governor vetoes something, he is required to accompany it with a veto statement. And so if you go to the bill on LIS, you can exactly see the veto explanation. And don't quote me on it, but I'm trying to recall it from memory. And I think he was saying something to the degree of he thinks that Arlington County does not want it. And whether or not that's true, I don't know. That's the governor's explanation. And you can read that in more detail, but I'm not sure where he's pulling that from, or if he's just. I will say a lot of his explanations didn't make sense. I know on my particular bills that he vetoed. For example, I had a bill that dealt with deferred dismissal. So if if you have a number of conditions, you're a first time offender and they say, court says, hey, you need to, do 140 hours of community service and pay restitution, and then we can we can dismiss your case, right? We won't convict you. However, if you have court fees, a judge can still enter a conviction based off the fact that you have court fees alone. So you could have done all your hours of community service, paid restitution, did whatever the court told you to do. However, you just owe court fees, and then they convict you for that alone. So that creates a system of haves and have-nots, and a two-tier justice system for those who can pay and those who can't. The governor vetoed it and said that there was no mechanism for collecting this money, which is completely untrue, because if you had talked to anybody in the courts, they would tell you they have a collections agency or a mechanism for collecting that payment. And so I think that he did a lot of last minute vetoes. I mean, he called me, I was trying to put my daughter to bed, and he called me at 10 PM. So she was, he woke her up. And then it wasn't him directly, but it was his staff, that kind of called at the last minute to handle a lot of these down. So I think they just had to come up with a lot of reasons on the fly. So that's a long-winded way of saying, I don't know, but he might have made it up.
Well, I hope the bill is going to be reintroduced in the next session.
I'm sure. I think if you talk to Delegate Hope, you know, he's pretty passionate about bringing that forward every year. And I can absolutely see him bringing that forward again next year, and I plan to continue to support it.
There's a purpose of it, it's to rectify a situation in which the government was formed in the 1920s to dilute the black vote. So hopefully this is an attempt to rectify that.
Right.
And I hope that the county doesn't oppose it. But anyway, that's just my.
And I didn't see any county publicly saying that they oppose it. But yeah, I do plan to continue to support that with Delegate Hope.
Thank you.
Do we have any other questions? Yes, Kathy.
I have a couple. Could you say a little bit more about the child care bill?
Yes.
The public-private partnership that you mentioned and the extent to which that would cover like grandparents raising grandchildren, because sometimes they're excluded from
Yes.
programs and services, unfortunately. But there's a growing number of grandparents who are raising their grandchildren.
Yeah,
in the
absolutely.
state. Yeah.
And my mom was a kinship guardian for a while before we passed a lot of the kinship support. So I completely understand where you're coming from. So my bill specifically is dealing with employers. And so this would be stretching state dollars by partnering with employers to provide that child care stipend to their employees. And so, you know, I know that my mom still works, and so there are a number of seniors and grandparents who still work, and if their particular employer is engaged in this program, then they would be covered.
Okay.
Yeah, so.
Did you say it was still a pilot or is it permanent?
So it would be a pilot. It would be a pilot, and then, but I know that the Arlington Chamber of Commerce is extremely interested in being the first to participate in this pilot. And so we're hoping to bring it to Arlington so then we can collect a number of different data points to share with the General Assembly to make it permanent. But 25 million is actually a huge investment for a pilot. So I was very proud to get that 25 million in so we can make sure that it was that it is successful. And so that's why it was a little disheartening when the governor didn't amend my wording establishing the program, but he eliminated the funding, which essentially kills the program. But it was a perfect union between making sure that we are supporting our businesses and then specifically incentivizing our small businesses. And then also retaining our workforce and making childcare more affordable for our workers. And you know, it was a great idea to stretch those state dollars. So we're very excited about it. And you know, I can't wait to see it kind of get into place. I hope that the governor doesn't continue to try to eliminate that after we rejected it.
Thank you, Delegate McClure. Do we have any other questions? Kathy, you
Yeah,
have
you
Okay, go
mentioned,
ahead.
under legislative efforts, increased oversight for nursing homes?
Yes. And let me give you the bill number.
Okay.
Because then you can look at the details of that.
Yeah,
It's SB 138.
the three, okay,
Yep, and then you can reach out to the co-patron of that bill as well, if you have even more information or questions about that particular.
Yeah, because that's particularly important with, federal funding and support, even like the ombudsman program for nursing homes, being, well, who knows what's gonna happen.
Right.
It's on the chopping block,
Yeah.
right? Yeah,
Right,
yeah, so
exactly.
having some states.
With along with a number of things, yeah.
Yeah, I don't see any other hands raised here or online. I have one question.
Asha, did you have a question?
No.
Okay.
Okay. So I have one question, and first of all, thank you so much for being the voice of, families, older adults, mothers. And I know you have to get out of here because your own, family and baby. So a lot of red states and blue states, Utah and California, New York, they're looking at local zoning laws to encourage, more housing, affordable housing. Is Virginia, as the legislature, are they doing, taking a look in that area?
Yeah, so increasing supply of affordable housing and then also making more housing more affordable has been a top priority, in the General Assembly for a very long time, which is why the Housing Trust Fund was established to create more affordable housing. So we need to keep putting money into that. That's one. And then, two is finding more innovative ways to create more types of housing that makes it more affordable. I had a single stair bill last year. We don't legislate the building code, but, my bill, directed a lot of those folks to look at the building code. We have our next building code review and revision in 2027. And, what I would like to see out of that is we allow for single stair buildings under 4 flights. So if you're 4 stories, then you should be able to have a single stairwell, which working with Pew and looking at the data is actually very safe.
Exactly.
And it actually creates more types of housing. It's cheaper and you don't have to buy up the entire lot. You could actually have half the lot. And serve more families because you can build multifamily units as opposed to a number of single units all across this lot. And, with fire resistant materials, with sprinkler systems, it's extremely safe. And, I talked to the developers when it came to this bill and they said that it would really make building, these types of, housing more, affordable for them, which of course, makes it more affordable for the folks who would be living in those units. And again, they don't have to wait years for this entire lot to open up. They can literally use a fraction of that lot if they are allowed to use single stair. But the way the code is written in Virginia is that you have to have 2 stairwells served above the 3 stories. So actually, it was 6 stories and below that I would like for the single stair to service. And so that's an innovative way to make housing in general more affordable. And then, some other ways, of course, is with housing assistance, and making sure that we have more housing grants available to people. And just thinking of different ways that we can keep, pushing for housing affordability in Virginia. So there's a number of things that, we're attempting as well in the General Assembly. Again, I'm on the Housing Commission. So we've talked about by right, building when it comes to churches and institutions, building affordable housing on their land. That has not passed the General Assembly. It has to be discussed a lot more. We don't have widespread, we have support for it, but we don't have widespread support across the General Assembly when it comes to by right building for affordable housing. But I think that is another way to ensure that we have affordable housing on land that is available where someone wants to build that affordable housing. And, we have these processes that unfortunately really hold back the timeline when it comes to building affordable housing when we needed it yesterday. So, I am personally in support of a by right action on that, but it's still being discussed throughout and studied throughout the Housing Commission and across the United States.
Yeah, thank you for taking a look at these common sense changes. And it
Yeah.
looks like we have one more.
One question, yeah, Kate Kramer?
Good morning. This is out of my wheelhouse as I do the medical side of the fire department, but just hearing the single stair access gives me a little palpitation. Is there a requirement for a second egress point, like a fire escape or something of that nature? Just, thinking of 4 stories, especially with elderly folks, if they can't get out one way, is there another option for them to exit in case of emergency in that bill?
So so it's not with, so that's why we say we don't legislate the building code, we direct the experts to do it. And so the stakeholders that this bill brought together included fire code officials, because trust me, I definitely, I know we talk about the palpitations, because I've heard it throughout the process. And we actually have some fire code officials nationwide who are working with Pew to discuss why it is actually safe in the way that they build it. And so we have directed a group of stakeholders to actually look at how to safely implement this particular policy. And so the building code revisions would come up in 2027. And they have a lot of innovative ways. We've seen, I believe it was in Seattle, Washington. We've seen in New York, the way they build these single stair buildings. And I think we actually have a couple in Virginia that exist that have been pretty safe for folks, the way they build those stairs in the single hall. So it's not specifically in the bill for that purpose, so that, I'm no expert at this in particular, but I do know the experts. And so that's why I want to leave the power within the experts' hands when it comes to developing that specific code and making sure that it is safe and that it is implemented in a very thoughtful way that can alleviate those palpitations.
Thank you. So thank you for sharing your time with us. It's so great to have you as a member, and look forward to hearing more about your hard work in the legislature.
Yeah, thank you. And I was gonna say, hopefully I'll be able to be in person more once the baby grows up a little bit. I myself need to find childcare. It's been rough. Well, thank you.
Thank you. So we have Melissa providing an update on the performance parking program.
She is online.
Good morning, Melissa.
Good morning. Can y'all hear me?
Yes.
Awesome. Thank you so much for having me. I'll share my screen. Here. All right. How does that look for you all?
Perfect.
Great. Thank you so much. This is my second visit, and I'm really happy to be here to provide you some updates on the performance parking pilot project in commercial corridors. A quick review of the purpose. We're basically testing out technology and administrative process in an attempt to make parking spaces more available more often through pricing and information. So these are our metered parking spaces. On the right-hand side of this slide, I'm showing a high-level map of the project area. So our pilot is only going on in the Roslyn-Ballston corridor and the Route 1 corridor. There are some metered parking spaces outside these corridors, which are not a part of the project. The goal is to reduce the negative impacts associated with the search for metered parking. So everything from double parking to cruising, erratic and dangerous driving behavior, the potential for extra VMT and emissions from that search time, and even going elsewhere to do business. So it's really all about not just adjusting price through a budget process, but using price and information as a tool to shape behavior and to try to make the most of a finite asset that we have. To date, we've executed on 5 price changes. So what we did a year ago, February, March, was we obtained permission from the board through an ordinance update to do these price changes administratively on a quarterly basis. And we have been analyzing those data on a quarterly basis and making a price proposal up through the manager's office for approval each time. This is an illustration of what our price packets look like. So if you're ever interested in seeing what each price change look like, or when one happens, what's the lay of the land at that time, the packets show information by neighborhood, and we only change price in the peak hours when it's relevant. So what I mean by that is on a given block face, if the occupancy exceeds 80% during a particular window of hours, but not all the hours of the day, we're not increasing the price across all the metered hours of the day. We're only increasing it during that peak time. So what you see here with a Clarendon neighborhood example is that 9 a.m. you've got prices basically in two buckets. You've got $1 to $1.50 an hour in that northwestern segment of Clarendon. And then the rest of Clarendon is basically somewhere between 175 and 225 an hour at that time of the day. Then at noon, come noon, and probably the change happens around 10 or 11 a.m. The price profile is going to be different when you show up in the neighborhood. And so you can use this map or other tools we have to say, okay, well, if I'm going to lunch in Clarendon at noon, I might try to park on those blocks that are still at $1 to $1.50 an hour and avoid the blocks that are showing up in brown now on this screen that are closer to $3.25 to $3.75 an hour. And they're up there because over the course of these price changes, those blocks have stayed very, very busy to the point that they probably are making it very hard for folks to find a parking space. And then the 6 p.m. hour again shows you what that looks like. It's even slightly more busy. So you see that those spots that stayed at 1 to 150 in the noon hour are going up to the 175 to 225 an hour. So we've got maps like this for every neighborhood, and we have an interactive map that you can zoom in and out of and check out from our website to look at any particular block you're interested in. Over the course of this year, we've been looking at the data, both for the purposes of each price change, but also just to see what's going on, and are we seeing any evidence that this effort is bearing fruit. This box plot is showing you essentially central tendency in two types of buckets. The orange box plots are the blocks where we've been increasing price in each quarter. So it's showing you that in the first price change, the subset of block faces which were quite occupied and required a price change had an average of 77.4 and a median of 80% full. And in the second price change, the orange box plot is showing you the distribution of all those blocks that required a change in, that had received an increase, and the same for the third price change and the fourth price change. So this particular, so before first price change is our baseline period. So we're seeing an ever so slight decrease in that average occupancy, median occupancy, or that central tendency shifting downward over time. We also are showing in the blue box plots the averages and the medians and the general distribution across the block faces where we either decreased the price or we left the prices unchanged. And so each one has varied. These aren't exactly the same subsets of spaces. Another way to look at this is geographically, what does peak time occupancy look like from our baseline period through our fourth price change? In the Roslyn-Ballston, this is the Roslyn-Ballston corridor just for the sake of illustration. And the color coding here across our geographies is showing the red are areas where on average, those block faces were showing up during their peak hours greater than 80% occupied. And the light blue on the other end of the spectrum are block faces that in their peak hours were less than 60% occupied. And in between in the gray is 60 to 80. And generally what we see in this kind of illustration is under the right-hand map for you, by the fourth price change, our peak time occupancy, we're seeing a bit more gray. In some areas, for instance, in Ballston, it's pretty visible, and even in Clarendon, it's pretty visible. The peak time occupancy is decreasing and getting into that sort of gray area, which is a good place to be, because we don't have to go far below 80% to start freeing up a couple spaces that make it possible for you to find a spot when you go to those blocks. So this is just another illustration of how we're looking at it. And a third illustration I wanted to share is a part of our process to figure out how do we communicate what's happening to people who are parkers who might not be data analysts, and they just want to know, what does this mean to me? This again is a baseline to fourth price change comparison of the relative availability of a couple spaces on a block. If you were looking there, if you were driving by and looking for a spot. And so the gray is less than 2 parking spaces are likely to be available during that peak period, 10 to 2. And the light blue is 2 or more spaces are likely to be available on that block face in that period. And so we kind of track, are the gray blocks changing to light blue blocks from this left-hand map to the right-hand map? And an example that we're seeing that change is on North Utah Street. I believe that's Utah. Sorry, it is small for me too. There are some changes over on 9th Street North. There's an extra space that becomes a little bit more available down on Wilson Boulevard between Randolph and Stewart. There's a couple block faces there that are becoming ever so slightly more available, so that you're more likely to find a space in this later period. We've also done a bunch of analysis during this period on ADA space use. So we specifically didn't change the price on ADA spaces throughout basically the first entire year up until just this last price change, and I'll explain why. We talked about how we were holding back on that because we wanted to be able to analyze it first. And we wanted to see what was going on. So what we see generally is that the average occupancy at our ADA spaces in each neighborhood is quite a bit lower than the occupancy of the regular spaces in those neighborhoods. We were also able to follow along and look at the rates that were applied to spaces, because if we weren't changing the accessible space price, but we were changing everything else around it, all the regular spaces, we wanted to make sure it stayed equitable. And so we did highlight and notice going into the 5th price change, these red dots that you see on the map are small areas of block face where the neighboring regular spaces are actually lower in price, were during the 4th price change, lower in price than the ADA space. And that's because we were lowering those spaces price due to their occupancy information, their occupancy data, but we weren't touching the ADA space, and that created a disconnect between them. So in our 5th price change, we actually rectified this, and on any block faces where the ADA price was showing up higher than the regular price on the same block, we lowered the ADA space price to match the regular space, so that differential doesn't exist anymore in the current condition. We were also using our data on ADA space use to take a look at and provide some feedback to the police department on what it means to enforce and sort of keep an eye on appropriate use of ADA spaces. And so this diagram is just showing you an example of looking at the total number of citations during 2024 issued by Blockface. These are ADA non-compliance citations. So someone parking in an ADA space who is not properly placarded. And so red being highest numbers of citations issued and light blue being lowest. And if there's no, if it's a project area block face with no color, there's been no citations issued on those block faces. And we overlaid that with ADA space occupancies greater than 65%. And that's because at greater than 65%, it's above average occupancy for an ADA space, period. And if it is overlaid with a low amount of citations issued, it could be that it's not on a routine route for enforcement, or it might not be in their awareness in terms of an area that needs to be checked on. So a particular example of that is in 2024, this little block of Wilson Boulevard down here, right as you're sort of heading onto, I guess it's 110 the route down toward past the Pentagon. We added some meters to this block face a bit ago, and it's possible it was never really updated with the police, that they knew that there was a metered segment down there, but the community figured it out, and there wasn't an accessible parking space added to that segment. It had received 0 citations throughout 2024, and it had a 35% payment compliance rate and over 81% average peak time occupancy. So this is an example where we kind of highlighted and brought to the attention of our enforcement folks, our partners across the way in the police department, to say, hey, you can look at these data and we can look at them with you. This might be a block face for you to swing by and check on, because it's very probable that the people parking in that space are not properly placarded. They just know that it's not on the typical enforcement routes. Another example of an analysis we've been conducting over the course of this year is an RPP impact monitoring study. And I wanted to highlight this for you all because we did hear early on in the project, before we even started price changes, a general concern that there was always the possibility that increasing price in metered spaces might push people into the neighborhoods and cause them to park on RPP segments. Now, we don't know from the nature of a license plate whether they've been specifically pushed from a certain block of metered space, but we have been on a quarterly basis collecting occupancy data for these red segments of RPP streets that closely abut areas of our general higher occupancy neighborhoods, to double check the higher occupancy neighborhoods of our performance parking project, to double check if this is actually happening. And I know this is a big table, but I just wanted to the overview of this entire table is that from baseline to the end of the analysis of the 4th price change period, we're seeing very little of that overspill impact, very little of an example of shifts that are in the direction of increased occupancy on those RPP segments. There's really just 2 key segments that are problematic. North Utah Street is in red, but it's in red in part because it's been highly occupied even before our project started. So its very first baseline data collection was almost 90% occupied, which is really high for RPP. And it's fluctuated in the 90s up to 100% occupied, and in the 90s the whole time that we've been collecting data. So I would call that a potentially dysfunctional RPP block for reasons that we haven't identified yet, but we're looking into that, and we're looking at what is the rate of parking RPP non-compliance on that block, and we in coordination with the police department. The North Wakefield Street segment is one where you can see it started at 60.9% in the baseline period, and it has gone up to, on average, 74% over the course of this entire period. In the 4th price change data collection, it was up at 87%. So that's one we have flagged with police to see if we've actually been out, we've verified there's a high amount of non-RPP permitted parking happening on that stretch, and we would work in conjunction with police to see if enforcement can rectify that, to see what the purposes are, might be behind it. Are these people who really don't live around there, or is there something else going on with the utilization of that street? So I wanted to share that because we are using that data directly in coordination with police. And lastly, just to wrap up, and I'm happy to answer questions at the end, I just wanted to highlight where we are now, our upcoming milestones, and what the calendar looks like for this project. So between February and this month, I'm conducting 1 year in updates like this one to different commission stakeholder groups. In March, that was our price change number 5. And in June, we will be looking at price change recommendation number 6. So that will have data that's extending from mid-March through April and mid-May. So we do these sort of 2-month data windows, and then we make recommendations for the price change after that. In September, we will be doing a pretty big engagement push, which is designed to interact with the community and get feedback on the proposed next ordinance. And so again, when I kicked off, I explained that we have an enabling ordinance that lets us do price changes on the meters administratively. And it has a sunset date. So if we do nothing, that ordinance expires at the end of February of 26, and the ordinance will roll back to what it was before. Our goal is to incorporate learnings from this project into a recommendation for a proposed next ordinance that the board would hear this winter. And with a rough calendar of a request to advertise in November and the board's action on a proposed ordinance update in February of 26. So the September engagement is that first engagement for the community to see what we're recommending based on the data and the analysis that we've done, to hear feedback and to fold that feedback into the ordinance that we propose. Yep. And that about sums it up for my slides, and I'm happy to answer any questions you
Sure.
might have.
Yeah, thank you, Melissa, for the thorough study and presentation. It looks like Charlie has a question. Charlie, and do we have any other questions here or online? Oh, we have a few more. Okay, Charlie, go ahead.
Yeah, thank you. It's very interesting. Is there a definition of success in terms of the number of space availability percentage you're trying to reach?
That's a great question. So the I would say an industry rule of thumb, which may or may not be perfect, has been that you want a space available on any block if you were going by. You would want to know that there was a space available so that you would have a place to park if you were driving and actually looking there. What that looks like as a percent is that roughly that occupancy threshold we've set of 80% full. So if it's 80% or less, most people will have success finding a spot without having to search a lot. If blocks go over 80% full, they're more likely to go by, and when they go by, not find a spot and have to continue to search around and get frustrated, and maybe we end up with those negative externalities. But we are looking at, there are different ways to cut these numbers, and as you can imagine, whether 80% means one space or two spaces or what depends on how big the block is, how much capacity it has. And so our goal is to, I would say, high level, we're aiming for that, getting all of our block faces during their peak hour performance under that 80% threshold. But downward directionality in that way would be positive performance. We're just continuing to do the data collection to see if we're seeing that trend happen over time across all of the block faces that we're influencing today.
All right, thank you. Peggy, do you have a question?
Yeah, just want to know, is there any data that you have on the capacity of seniors using any of these, any corridor, both of those corridors, or?
We don't have data specifically on our parking users. It's a really good question because we don't have a good way of gathering demographic information of our users. The best way we might have is if our mobile payment vendor wanted to share information that's provided by their customers, but thus far we haven't been able to come to any agreement for them to share anything other than the money. And they actually do they do notifications for us, so users of the app will potentially receive a survey prompt at the end of a parking stay that asks them how their parking experience was. That's a part of this project. You might receive a prompt about the project in general if you haven't parked in the area in a while. So they are helping us with some communications, but on the whole, there isn't a great way to gather demographics short of intercepts. And most of our intercept work has been focused on people's feedback on the experience rather than collecting their demographic information.
All right, and Roland, you have a question?
Melissa, in doing the pilot project, do you factor in any way road work? Because there are various areas, for example, Pentagon City, Crystal City, where literally blocks are, you can't park anywhere because of the road work. Do you factor that in any way as you're doing your data analysis?
Yeah, we do. So basically, because our data is based on sensors in the ground, sometimes construction will actually dig those sensors right up And when that happens, we know, and they go offline and we have to put it on the list of things to replace. Other times the construction or the road activity might just block off an area and not let it be accessed, but the sensors are still there. And we have a couple ways of detecting that. One is if the trend in the data is empty, 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 empty for some unreasonable period of time, it flags for us and we'll look at it and we'll see how long it was set that way. But we also have a dashboard and tools to monitor permitting, right-of-way permitting processes that happen. So when people pull permits to do right-of-way work that's going to impact our system, we actually do usually get some of a head start notice on when that's going to happen. So there are opportunities to eliminate areas from consideration in a data analysis. And again, if the sensor itself gets pulled up, that block or block face is eliminated from the data analysis, and we're only really looking at spots that are actively being used.
Thank you. We got two questions. Peggy has one, Joan has one. Do we have any other questions? Because I want to make sure we address everyone. All right. We'll go to Joan and Peggy, you have a chance. Go ahead, Joan.
I'm just wondering about public engagement. Do people who are in the RV area and Route 1, are they aware this pilot is going on? Are there signs up that say the price that your meter may change at a certain time? I'm just wondering, do people know this is going on?
That's a great question. And so a description of some of the stuff we have in place. There are decals on every meter, decals and signs on every meter that we've installed as part of the project that tell you it's part of performance parking, and the price could change. There's ways to look at availability through our tools, QR code, and so forth. And we've had those up for a really long time. We have also installed in a lot of our neighborhood streets, not everything, but you'll see on some key corridor intersections, signs that are zip tied to the traffic signal poles around the intersection saying, hey, did you know there's variable pricing in this area? Did you know this is a higher cost street? You can check out these other streets. And we're continuing to work on additional layers of notification that are, I would say, we tried for a long time digital, like pushing people to our digital tools, and we are struggling to get people to use our digital tools. Our theory behind that is there's information overload, and a lot of people don't want to plan one more thing in their lives. They'd rather just go and figure it out and then and be on their way. We've done direct mailers to households, several thousand at this point, and we're going to be experimenting based on sort of awareness that we hear of that, spreading those direct mailers out to more households off the corridor, like in the neighborhoods where they might not see those signs that we're putting right where the meters are, but they might get something in the mail and it could raise their awareness. So we've tried a bunch of different methods in addition to our standard, pop-ups at farmers markets and other kinds of engagements where we might catch people where they are. But we continue to try to improve upon that. And if y'all have any specific ideas for places we should be or methods we should use, I'm certainly open to it, because your average intercept still runs into a parker who isn't aware of the program and is interested in the tools for finding cheaper parking or more available parking, but they're not necessarily aware that there are options out there.
Peggy, you have a
Well,
second.
I was just gonna ask about, what benefit does this pilot program does for me as a senior? And she mentioned cheaper parking perhaps. And I mean, what is the major benefit of it? How does it help me as a senior?
Melissa,
Yeah.
can you hear the question? Go ahead.
Yeah. The goal of the project is to help you find parking more easily where you want it, when you want it. And so it does mean that there are tools to allow you to proactively pick cheaper parking spaces if that's important, if price is important to you and that's your priority. So the maps are there. We don't change them we don't change the price that often. So you can really reliably know that's going to be the cheaper block during that time of day. But also, we want to make sure that if your priority is convenience, that you're both aware of what you can pay, and when you go to the higher price blocks, there are fewer people competing for those spaces because we're charging more. So some people who are price sensitive may switch to another block. And that means in the time when you're really location sensitive, you can park there and you won't be delayed. You won't be circling around trying to find a space. So it's really both things. We want to make it more available when you want it, where you want it, regardless of price, and to give you tools to find the cheaper price options, which are really, in most cases, just a block or two away from the original expected destination.
Great. Joan has the second round as well. We're gonna move on after this, but go ahead, Joan.
Are there other jurisdictions that have done this kind of pilot? And what did you find out were the results from there?
Yeah. Some major jurisdictions, DC, San Francisco, Boston, Seattle. There's several big cities that have done pilots just like this in different sizes, scales, and locations in their communities. And by and large, all of that data pointed to the effectiveness of price over time in shifting behavior and allowing there to be more availability in those really high demand congested blocks. So they all point at the potential for success, but they also almost all point to that it takes time. And some of these projects have been going on for several years. And in most, it took a year or more of the repetitive process and just like getting the word out and getting people used to it for those behaviors to shift. So I think we're still in that window of seeing what we would generally expect. But we're also in this, it's a pilot on purpose to see how effective is it here under these circumstances. How can we partner with enforcement to raise awareness of price? Because again, if folks don't pay at all when they park, they're not going to be particularly sensitive to a change in price. So we work very closely with police to provide them information on what we know about how the curb is being used and payment compliance so that those pieces can work together to increase awareness of price and hopefully the availability of spaces.
Well, Melissa, thank you so much for conducting the scientific study, for engaging with us and sharing your findings. So thank you so much.
Thank you.
So, yeah, have a good day. So we're a little behind our schedule. Our next item on the agenda is approval of the February 2025 meeting minutes. Do we have a motion and a second?
I so move.
Second, great. So, all in favor? Aye. Any opposed?
Just have one minor edit.
Oh, okay, all right, Ellen, submitting a minor edit from the vice chair.
Thank you.
All right, so the minutes pass, so thank you, everyone. And our AAA director has a report coming up. Helen.
All right, good morning, everyone. It's so good to see everyone and good to be back in person again. So I'm going to start today with a staffing update. First of all, I want to announce and congratulate LaShawn Cager-Brown. LaShawn has been with us just about 3 years in our Aging and Disability Resource Center, and she was recently selected for the Human Services Clinician 3/Team Lead position. So big congratulations to Sean. That was LaShawn. It was effective on April the 6th. So she's in her 3rd week. Yep. And so now we, of course, do the domino game, right? So LaShawn's position is now open, and so we are actively recruiting for that and hope to have that one filled soon. So one day the ADRC will be fully staffed and we'll go forward. I do want to thank everyone who helped out with the Community Engagement Forum. It really does take a village to put that on, but I am counting it as a big success this year. And so thank you to all of you. We do have, we're in the process of looking at the survey responses we got back, some of the feedback that we received, and hope to have a report for you at the June meeting. Okay. And then we will not meet in May, just a reminder, because of the conflict with the Governor's Conference on Aging. So I hope some of you are planning to travel down the road to Williamsburg and attend the Governor's Conference. We will not meet in May. Our next meeting will be in June 16th, I think it is.
Can we we find out who's going from the commission and maybe get together or?
Sure.
Yeah.
Sure, yeah. Yeah, I can send a poll out
Okay,
and see.
that'd be
Yep,
great.
yep. I know Carlos is going, that's the only one I know. Yep, Kathy's going, okay. Okay, so let's see, budget, we heard the report from Delegate McClure about the $750,000, for the local agencies on aging. It's been a bit of a whiplash with that. And hopefully the governor will sign it on, May 2nd because the funds are desperately needed. I'm also really pleased to report that the county board, when they adopted the FY 2026 budget, included the $105,000 for Meals on Wheels. That is really huge, because this is the first time ever that we've asked for local funding for that program, and the fact that we received it as well, really speaks a lot to the interest of our board in ensuring food security for everyone, especially our older adults. So thank you to everybody for your advocacy and support, for this funding and also for the Meals on Wheels program in Arlington. Okay. A gentle reminder that the Commission on Aging is considered a public body under COA. And so therefore we are subject to the open meeting requirements. And that includes both the main Commission on Aging as well as any committees, okay? And so that means that if the meeting is an in-person meeting, we have to have physical quorum to have the meeting, okay? If there is not physical quorum, we are supposed to adjourn the meeting and go back home. I don't want to see that happen. That's a waste of everybody's time. So if the meeting is declared as an in-person meeting, physical quorum has to be established before the meeting will start. Okay. All right. So this time of year enters into yet another busy season for the Agency on Aging. It's the time of year that we're working on our area plan. And for those of you that aren't sure what that means, this is our contract with the state on how we're going to deliver the programs that we receive the funding through the State and Older Americans Act for. So typically, we submit a full area plan every 4 years, and then the in-between years, we do an update. So the last full plan we did was 2024. So this year should be an update year. But there have been a lot of regulation changes to the Older Americans Act, and so we're being asked to create a full plan again this year, and then next year will be an update, and the year after that will be back on the regular full plan schedule. So, let's see, couple changes. So we have always reviewed our area plan submission with you all, the Commission on Aging, so that you're aware of what we are putting forward. But this year, they're actually requiring that we hold a formal public hearing and that we have a 30-day comment period on our area plan, which then just backs up the timeline of, you know, I have to get it done sooner so that we have time for those steps. So needless to say, it's a pretty tight schedule. There's information that I don't have yet, including budget information from the state. So we're working hard to get this completed. DARS is helping us. They've sent us a 90-page companion guide to help us figure out what we're supposed to be doing. And so they are also hosting some 90-minute trainings over the next few weeks on each of the significant sections. So they're doing their best to help us through this process. But it's just really, I'm going to need to be heads down focused on this for the next few weeks. So I just ask for your understanding if I don't get back to you right away. You know, it's because I'm heads down on this area plan trying to get it done. Okay. So with all of that said, I do also have a personal note that I would like to add. I have decided to retire. And that will be effective June 27th. And so I just want to say, you know, that this job has truly been the highlight of my career, and it wasn't an easy decision, but I feel like it's time. And so I have truly enjoyed working with each of you and have learned a lot, and I'm going to miss you all, but I've already added my name to the colleagues in aging, so I can at least keep a pulse on what y'all. And also looking forward to joining the Aging Network and the new community that we'll transition to. So with that, I'm going to end my remarks and hand it over to Rachel.
Well, I just, we also want to, yeah, thank you. Just the best for you and your family. You're an expert in your field. You're a faithful friend. You're a tireless advocate, and we really appreciate everything you have done. And and there's more, I'm sure, that.
I still have 10 weeks left, so.
That's right.
I'm not running out the door. I'm just slowly
And is the new plan, is that gonna be?
So I'm gonna have it.
When's the deadline for that, I guess is my question.
So with the plan, right,
Yeah,
so,
that's a
so
lot.
it does have to be submitted by August 1st, right?
Okay.
But my
Okay.
plan is to have that substantially completed before I go. So that, you know, as public comment comes in, it's hopefully very minor updates, if any, and then it will be ready to go. So
Yeah.
that's the plan.
Yeah, yeah,
Okay, good.
because it was like, I mean, the new regs weren't a huge overhaul, fortunately, but there were some changes around contracting and like congregate meals, I think, and
Some grab and go options.
grab and go,
Yeah,
yeah.
Right,
Yeah.
right.
Yeah.
And whatever, you know, whatever was in those regulations, kind of forced the state to redo their state plan on aging,
Yeah,
which then trickles down to
Yeah.
all of us. So,
All right, thank you.
yeah.
okay.
And next, our director of the bureau, including plans for a party for Helen.
We are so proud of Helen and she is going to be sorely missed, but we will have fun celebrating her. She is going out on top and so Friday, June 27th, in the afternoon, save the date, more to come, but we will have an opportunity to celebrate Helen. She's given us the permission to do that, so more to come, but please do save the date and we'll be sure to keep everyone updated about recruitment plans. We know Helen is irreplaceable, but this work is so big and so we will continue to build on her legacy, but we'll have ways to recognize and celebrate Helen, but she will be missed for sure. Whew. So more to come.
Okay.
If anyone's a party planner or event, Link, looking at you, we'll definitely have some planning. And as we speak about retirements, we've also had some retirements from other programs within the Bureau. Patty Nance from our Adult Services team, Jackie Igo from Adult Day, and Rita Blue from Adult Day have all retired as well. So we've had a chance to recognize those individuals and celebrate them. They've made Rita worked for Adult Day for 36 years. So their impact has been felt and we will hopefully be able to recruit for those positions very soon as well. But the work continues. We keep busy, and one of the events I want to highlight is that Arlington had been selected as a benefits enrollment center. We continue to build on those successes, and on May 6th, we are planning a community benefits and health fair. We will be sure to share the flyer, but we sent personal invitations to over 700 individuals who receive, older adults who receive some type of housing subsidy, but we've basically rented out this entire, reserved this entire lower level. So we're gonna have community partners and vendors down here. We'll have staff who will help people apply for benefits like SNAP, energy assistance, Medicare, Medicaid subsidies. We'll have Alana, who is our registered dietitian, doing some cooking demos. We'll have health screenings. So I know VHC, Neighborhood Village are all going to be here, AARP, we're building together. A number of our different partners will be here. So if you're able to join, please stop by. We'll be here 10 to 2. But please do share it with your networks. We met with the ambassadors last week, I think, and they'll be here and just sharing the message, making sure people know about this, that we are a trusted place where people can apply for different benefits and services. With that, we continue to see an increase in unhoused older adults who are experiencing homelessness, housing instability, and our next task force to address unhoused older adults will be on May 13th at 10 a.m. on Teams. And we'll be talking a little bit about kind of resistance and how do you address barriers when someone may not want to leave the shelter or may not want to participate in a plan to help them be rehoused or maintain housing. So it should be a great discussion. Helen mentioned some updates about the budget. We really want to thank you all for your advocacy, not just for the Meals on Wheels, but also one of our very close partners, Culpeper Garden. The assisted living was awarded an additional one-time $350,000. I think you all may know that we help support, there's a care subsidy for individuals in the assisted living section of Culpeper Garden. It's one of only 2 affordable assisted livings in Arlington. And we know from the Age Friendly Action Plan, the need for affordability, even in assisted living, is a growing need, and the wait list for programs for both Culpeper Garden and Mary Marshall is pretty extensive. I thought I saw Wendy, but I want to thank Arlington Neighborhood Village. I think probably 2 meetings ago, we made a call with unhoused older adults. We do have individuals sometimes that show up to our office without jackets in the winter, sometimes without appropriate clothing. And Wendy and Arlington Neighborhood Village donated like a car full of clothing items. So much that some of it was donated to Path Forward as well. But just thank you, Wendy and Arlington Neighborhood Village, for those donations. They were put to very good use, I think, within days. Someone showed up, she didn't have a jacket at all. We were able to give her one that had been donated, and she had said, it gave her a sense of dignity because it was a name brand. And she had said, I don't remember the last time I've worn name brand clothing. And so just thank you, Wendy and Neighborhood Village. And then, there's so much happening at the federal and national level. Many of our national partners are following closely. US Aging in particular has been following and sending out updates. We will try to share those, and I think Helen has been sending them as much as possible. But there are a number of different impacts that are being had, including the elimination of the Administration for Community Living within Health and Human Services, or HHS. It has been folded into 3 different programs, but US Aging is continuing to advocate that we need dedicated aging services and leadership to help advocate for needs. And then opposing any cuts to Medicaid or SNAP, because we know that those will have devastating impacts on older adults, but all of the individuals who benefit from those as well. So we'll continue to share updates. There's a call later today that US Aging is having. It's a lot of information, so we'll try to share that as we receive it. But then we started with the party. I also want to kind of end with some good news as well. And I'm looking over at our 90+ club over there, but we have another birthday we want to celebrate. Our beloved legend, Joe McDermott, just celebrated a milestone birthday. He's celebrating all month, so share your accolades. But Joe has had such an impact on older adults, on our community, and we continue to stand on your shoulders on Links, and we're so gracious that you continue to spend your time with us. So happy birthday.
Thank you very much. I just feel I need to keep moving, and it keeps me going. So, and I'm going to invite Helen to join us on the sidelines. She seems very young. So, and I was first appointed to the commission in 2010. And then I served 2 terms, and I was chair for 3 years because Mitch Opolsky said, "Oh, I'm not ready yet to chair." So I served an additional year, but I enjoyed it. You're going to keep seeing me.
Thank you, Rachel.
Yes, so thank you, Rachel. Thank you for all our legendary supporters, and happy birthday to Joan. So Maimuna, the Director of Aging and Disability Services, how are you doing?
I'm doing well. Good morning, everyone. Getting back from vacation, so I'm still catching up. It's special thank you to Rachel and Helen and Jim and all the rest for covering for me last week. It's good to be back, and I will join the crowd by saying happy birthday, Joan, 90th year and counting. I remember when I was the staff liaison to support Joan as the Commission on Aging chair, and I learned so much from her. So happy birthday, Joan. I also just want to mention a couple of things on the Arlington County front that you may be interested in. I know from affordable housing standpoint, uh, some of you might have participated in the Housing Commission's Affordable Housing Ordinance Work Group. I'm not sure, but that was April 15th. I realized that was a week ago. The Department of Community Planning and Housing Development, CPHD, the acronyms, released their quarterly rent report. And if you didn't receive a copy, I can share that link, and Helen can also share it with commission members, but I'm sure you would be interested in that with all the advocacy around affordable housing. So that first quarter rent report from our colleagues is out. And what they've seen is a 2.4% increase over the consumer price index in terms of rent. And also, there is well, that passed as well. I'm sorry. I'm still catching up, so I won't mention that. But yeah, we are in DHS, as Rachel mentioned, following closely, the changes in the federal landscape. We continue to do our work in terms of, looking at centering race. That hasn't changed. Our mission, vision, and values have not changed. We have partnered with the Community Foundation to do more immigration clinics so that when there are questions from our community members, our clients, and even staff as it relates to immigration policy, knowing their rights, for anyone that has immigration status. We do offer monthly clinics, and we're partnering with that foundation. So we're very grateful. In fact, the next clinic is tomorrow. So it does help staff, in terms of answering some questions, getting clarity, especially in this evolving landscape, to be able to push that information out and equip their clients so that they also know their rights. And that's all I will share for now. Are there any questions?
Do we have any questions for Maimuna? Thank you, Maimuna. No,
Thank you.
apparently not. So thank you so much, Maimuna. How's everyone doing? We've been at this for about an hour and a half. Do we need a 5-minute break or drive on? Looks like driving on. Okay.
I just have a quick question from Maimuna. Does the county have data on older adults, people over the age of 60 who have immigrant status? Just curious what percent of. Yeah.
That's a good question. Rachel, are you aware
I
of
know the
having?
census data, the most recent census data, I believe for older adults, which 60 and above, 25% identify as foreign born on the census. That's how they're listed.
Okay.
But for actual programs, it is not something we track. And that's one of the things we do want to iterate is that for many of our services, we do not ask citizenship. So we want to make sure that people continue to access appropriate services. There are some programs that do have eligibility. So SNAP, Medicaid, those programs, you do have to be a citizen to qualify for those programs. But for many of our programs, we don't ask or track that unless it's a requirement for eligibility.
Okay.
Well, the program with ACF sounds really wonderful.
Yeah.
The clinics.
Thank you, Kathy. And, so anyway, next, chair's report. So there's been a number of, items, for example, my Moon just noted, there's a lot of changes at the national level. And, we've heard about the good works at the local level that the board is, our Great County Board is doing, such as restoring money to, Meals on Wheels and what the state is doing, as Delegate McClure said. But there are three areas, I mean, you read the news as much as I do, and three areas at the national level that are affecting families and older adults in terms of food, shelter, and health. And so not only take notice, but you can also take action, and you don't have to do it yourself. There are national organizations, some have already been mentioned, who are focused on it, and action could include they have automated letters that if you put your address in, they'll send letters to your congressmen, senators, all the way to other actions that you can take. So regarding food, the federal program that funds Meals on Wheels and Meals at Senior Centers is the Older Americans Act. And that has not been reauthorized, so funding is at risk. And bless you. Organization that is advocating in that area is the National Council on Aging, NCOA.org. If you go to that, you can learn more, you can take action. Regarding shelter, the largest federal program for housing is not actual buildings, but it's the Section 8 Housing Choice Vouchers. That program pays 70% of the rent for families. And 30% is paid by the families, people who are earning as little as $30,000 a year in the Arlington area. So the organization that's dealing with that is the National Low Income Housing Coalition.org. So it's NLIHC.org. And last but not least, health is everything, right? Last week there were reports that Medicaid may be cut, and the organization that's dealing with that, and that's apparently, I believe, $900 billion over 10 years, so that's $90 billion a year. It's MedicareRights.org, MedicareRights.org. So yes, advocacy works, and take a look at those things and take action. I wanted to underline that for you. You've heard a lot here, and there's something that you can do. Next, committee of work group updates. Housing. Michael, Audrey's not here. Go ahead.
So I just limited things. Audrey is on the Housing Task Force with the Housing Commission. So she'll give updates on that at the next meeting. But other than that, we have on May 13th, we have a hybrid meeting for the Housing Committee, May 13th.
Super. And I know she's also on the ordinance committee, if I'm not mistaken. Okay, great. Thank you, Michael. Do we have Anthony online?
Anthony is not online.
And Roland, do you care to provide any updates on legislation? Don't want to put you on the spot.
No. And I'm gonna ask, Erica, because I know Erica is also online, and she would just sort of pitch in too as well, because she's been keeping track of this. We've been, at the executive meeting and the last meeting of the legislative committee, we did an assessment on Environment's proposals. And I think the bottom line is we were not too successful with this particular legislative session in getting any of these proposals passed. And Eric, is there anything you want to add to that? Because I think we're 0 for 6, but am I wrong? Are we 1 for 6?
So we don't know yet. So the money for the area agencies on aging is in the hands of the governor, and we'll know that by May 2nd. So we may have 1 in 6.
All right.
Not too successful, but we're gonna keep at it.
Yes, and next year is a new date, right? So
Then Matt, last week and did the brainstorming for the 2026
Right.
session. So the next steps in that will be a voting process for those priorities, and then at the May meeting on the
Yeah.
27th, we'll get down to the final
Yeah.
budget.
As Alan said, the next year's process is starting, so everyone is welcome to join. And, be a part of it. New governor, we have a very energetic legislature, so, your action is welcome. Long-term care, Charlie, how are you?
Good. The long-term care residences work group met at the Cherrydale Nursing Home on April 10th. We're trying to meet at as many of the facilities as we can. In fact, our meeting, our May meeting is going to be at Collins Springs Health and Rehab on May 8th. And, others of you who are interested in seeing these facilities, please feel free to join these meetings, because we do get a tour of the facility. We get to hear from the director. Cherrydale has been the easiest to work with. They have had on and off a community advisory council, which we've reinstituted recently. In fact, we're meeting on it this Wednesday. And their director has been very, very cooperative. They are the biggest facility in Arlington, 210 beds, with a census right now of about 197, I think they've said. And it's a challenge to run a facility that large and provide quality, dignified care to individuals. And our committee has, as part of the age-friendly plan, they aim to have community advisory councils in all the long-term care facilities. Right now, we've got this new one going in Cherrydale. There's one at the Carlin Senior Residence. There's one at Mary Marshall that has been going on for longer than our current ours at Cherrydale. And we really kind of would like to make that a kind of a pilot that we could pull together some data and goals for success that we can then kind of develop a white paper or a model to put out there. Because the committee is a big believer in the fact that this is one way to create transparency in nursing home care. And you start bringing community members in, it's no longer a black box in the community that nobody knows what's going on. So that's very important. So if any of you want to come to the Carolyn Springs meeting, that facility that's had a lot of difficulty. All the three of the freestanding homes, and probably Jefferson too, have not had surveys in the last couple of years. The last survey at Cherrydale was August of 2022. So we're going down almost 3 years since a survey. And that's one of the weaknesses of our state system.
What time is the meeting? What time is the meeting? Yeah.
I can tell you, I think it's 10 to 11:30.
Thank you.
Do we have any other questions for Charlie, Roland, or Michael?
It's not a question, but maybe just for trying to mention that Delegate McClure about SB 1383. It would be interesting to ask the administrators and the staff what their perception of that proposed bill would be. And we know that oversight of nursing home staffing has always been resisted oftentimes by the communities themselves because of the cost, but might be interesting to sort of ask and engage in dialogue with the administrators around that.
And I believe also Erica can fill us in on this, but I think the bill that increased fees for nursing homes to help pay for the survey and certification system was increased. Did that pass?
Yes, that passed. There were 2 nursing home enforcement bills that passed, and both of them very, very much needed.
Right, thank you so much, and also please get involved. You get to work with Maimuna and Charlie, so those are great. All right, Catalina, you're online and there's been a lot of activity in transportation, Catalina and Jones, so please go ahead.
Hi, everyone. Last Transportation Committee meeting was on March 14th, so it was around the same time as our Community Engagement Forum. But in that conversation, we had someone from the National Aging and Disability Transportation Center, NADTC, who joined and presented some different resources and gave a little bit of an overview of their work. So that was really great conversation, and I'm happy to share out any of those materials if other folks are interested. But the next meeting for our transportation committee is in May, so it's on May 9th, and I believe it will be an in-person meeting. So I'll send out more on that in the coming days. Aside from that, for the Arlington's Transportation Future Advisory Group, we met about a week ago. And so in this meeting, the project team went over this refined draft vision and draft goals based on the feedback that they had heard from all the different liaisons from the various commissions and committees and the general public throughout the phase 2 of engagement, which started, I think, around March. So they collected a ton of feedback, and good news coming out of that conversation was the original draft vision didn't have any reference to age at all. It was sort of generic to say, like, Arlington's transportation network should enable people of all backgrounds and abilities to move safely, comfortably, etc. So the revised, refined draft version now says people of all ages, backgrounds, and abilities can move safely, comfortably, and seamlessly in Arlington. It continues on, but I did like to see that age piece was incorporated, and then some of our other pieces of feedback around, older adults needing to get to other things beyond like jobs or just like family and friends, but to essential services. Like that kind of essence was incorporated too. They included the word opportunities, connecting people with opportunities. But at this point now, they're continuing to socialize this refined draft with other commissions and committees, and then I think they're speaking to the county board in July sometime. So they're still gathering, more feedback, and so I'll share out and I'll send an email with just like the updated language so you can kind of see the before and after, and try to get some of your input on that. But I was very pleased with some of those updates. And then other things, still working with Kate and the Health and Wellness Committee to sort of get some questions answered around transportation as it relates to the Virginia Hospital Center. So we'll continue to coordinate with them, and then maybe we'll be able to do like a joint meeting together sometime in the coming weeks. And then Will and I had talked a little bit about this, but I'm trying to reach out to some contacts within the Transportation Commission or the Transportation Department to better understand the county sidewalk conditions survey that they did in 2024. They have a really great map with a lot of data. But just as we think about, advocating for pedestrian safety, that is a great resource that they've already done a ton of research into. So trying to build on some of the work I think that Jim did too last year or years prior. And then the other thing to note, this week I'm at the On Aging conference. It's the American Society on Aging's big annual event. This year it's down here in Orlando. So that's why I can't be with you in person, but there's tons of great topics, and the agenda and the schedule is all online. So if there's anything that anybody is interested in, I'm happy to try to connect with someone or pop into a session. I'll be trying to join as many as I can. There are some on livability and transportation and all different other things. So I'll share out anything I find from there. And I think the last couple of things I know in the news, Joan, thank you for flagging a couple of these things, but there was a piece in Arlington Now about like some latest Vision Zero findings. And I think it said that the fatal crashes in Arlington dropped to a 6-year low in 2024, with one person dying in Arlington from a vehicle crash last year, which is the lowest number the county's seen since 2018. So that's good news, but we'll continue to kind of monitor, and look through that annual report. And then I did also see that there's a microtransit pilot that's going to be, I think it's launching later this year. So trying to help people, get transportation when the bus routes only go so far and they have to continue elsewhere, kind of filling those service gaps. So lot going on. But I think those are the main things.
All right. Thank you so much. Joan, anything else on your side?
No, I don't have anything to add.
And Peggy, also, I was talking with Peggy and she was, updating on transportation issues at the meeting, Civic Association meeting, so, thank you for doing that.
No additional comments.
Okay, thank you. I know, WMATA and all the, the tri-state, jurisdictions are looking at future funding, because that's a big part of, the metro and the bus lines, and, more to come on that. There was something else I was thinking of, but, I am going to, until it occurs to me, I'll skip that. Any questions for, Catalina and transportation? All right, aging equity, and I think Roland is handling that as well.
Because Carlos isn't here. We were pretty successful in our forum that we had on fraud. We had it at Walter Reed at the end of March. We had a pretty good turnout for it. We had a representative from the FBI and a representative from Senior Patrol, and also Michelle Thomas was pretty much on the staff. We actually had more people in person who attended this than we had online. So that was very, very good. We ended up bringing in chairs because we had more people who kept coming in for this. And what that shows to us is that there is this interest on the part of people in our community to know about fraud. We talked a little bit about AI. We talked a little bit about romance scams, which drew a lot of questions pretty much from people there in the audience, some who had gone through something like that, and one who wanted to know how to deal with a friend who's going through something like that. So what we're going to do at the meeting that we have scheduled for this Wednesday, we have a committee meeting. We're going to be talking a little bit more about that. And we're also going to be seeing what we can do to expand and have more sessions pretty much on fraud, because this was the second one that we did in the last year, and we've been pretty good so far as attendance is concerned on that. Members of the committee on another matter attended the Theater J production of Your Life Means Dreams, and they met the playwright, and they also met the actors pretty much after the show. There was an interview that was coordinated with Cheryl of Aging Matters on the script because it dealt with the role of caregivers as technology evolves. And did you want to say anything on that?
I think the last meeting, it was mentioned, and I did get tickets and went with a friend. It was really, really great.
Good.
About definitely bringing forward issues around caregiving for sure, social isolation, substance use too, and the role of AI. I mean, it was really, I think, profound in some of the issues that were raised in the play. But thank you so much for.
And once we found out from Cheryl when it's going to be on Aging Matters, we'll give everyone pretty much a heads up on it so they know which session. Unfortunately, I have to report that we were not able to secure funding for the cross-generational book club that Carlos is working on, but we're still gonna look into other means pretty much of trying to find some sort of funding for something like that. On another matter with Carlos, I have to report that his term ends as a member of the commission the end of July. And that will be the end of his second term as a member of the commission. So he's going to be hard to replace, but we have to start thinking about reaching out and making sure that we identify and recruit a new member pretty much of the commission. And I hope that Carlos is still going to stay active in the commission. We have been very successful so far in reaching out to the Arlington Community Foundation on certain matters. And of course, Carlos has always been very, very active with the Arlington Community Foundation. But this year, what the Arlington Community Foundation has put together is an outreach effort to the LGBTQ community. And it has gone pretty much the outreach has gone the spectrum from young to old. They put together like a task force pretty much on it. I'm a member of it, Carlos is a member of it. We're gonna be having someone to come and speak about that at the equity meeting that we have on the 23rd, which is pretty much this Wednesday. So hopefully we're gonna be able to get some very good information on that. On another note, I was able to attend a panel discussion, although it dealt with the Capitol Hill Village, which is the DC equivalent of the Arlington Neighborhood Village, on the matter of LGBTQ plus issues in nursing homes. So they had a very pretty much good discussion on that. And I'll pretty much report on that at the meeting as well. And I think that's it.
All right, thank you, Roland. Do we have any questions for Roland?
I just want to mention, thank you, Roland. That sounds wonderful, and a diverse outreach plan that has been working effectively. So thank you, and Carlos, and your efforts. I forgot that Carlos was a part of the Arlington Community Foundation, so I did put in the chat the flyer around the immigration clinics, and it is open to volunteers. It's not just staff. So anyone on this call or in this meeting also has access to register. But I also wanted to mention that our colleagues in Fairfax County in the Agency on Aging have a scam jam, and that happens to be on the 23rd as well, so this Wednesday, but they're still accepting registrations, and it is focused on fraud prevention and protecting older adults. What's really cool about this particular outreach event is they have Paul Greenwood, who may be a familiar name to you. He's a retired deputy DA, and he's going to be presenting on elder abuse prosecution. And then they have a film that they are going to release called Heroes of Adult Protection. And they're going to be able to provide a panel discussion on that film that includes the filmmakers, local police, and some of the APS investigators. So there's still time. It is an all-day event, 9 to 3 p.m. And I put the registration link in the chat as well. Lunch is provided.
And on that note, I forgot to report, and thank you, Maruna, for that. I want to thank you for the work that you did on the panel for Advance Arlington. For those of you who don't know, that Advance Arlington recently had a panel on aging in Arlington. And Maruna was the one who was the moderator pretty much of the panel. Excellent turnout that Advance Arlington had for that. And pretty much an excellent discussion on issues, aging issues, pretty much in Arlington.
Yes,
Thank you, Roland. Thank you.
And I'll just mention that Wendy Zinker was part of the panel and Mitchell Polsky also. And then I can't think of her name, but the woman who heads Culpeper Garden. And then Christine Dolan was there about more financial matters. So it was, Roland is right, it was well attended and lots of good information, and Maimuna was a wonderful moderator.
Thank you, Joan and Maimuna and Roland.
Thank you.
Really appreciate it. There's so much great work out there, so appreciate it. And last but not least, Kaden.
Here we go. Yeah, I will be brief and also let Kasha chime in if there's anything to add. So the Health and Wellness Committee met in March, and that was really an opportunity for us to hear from Michelle Thomas. She provided a really excellent overview of Medicare plans, the different Advantage plans that are available in this area. She put together really clear, succinct charts, one-pager. So our committee found it helpful, both as a committee as well as people who professionally can use that in their job. So just recommend, if that's of interest to you, to reach out to Michelle. She could probably provide that one-pager for you. And then in April, we met, we're still in April. I feel like we're in May. This month, earlier this month. I won't jump the gun. We had a really good, engaging discussion with
5 to 6 members of the Macedonia Baptist Church. It was an online discussion, including Reverend Craig Harcum, and just kind of engaging with them about what they feel are their needs. I mean, it was a really nice tie onto the community engagement forum, but really hearing directly from a few folks, what do they see as needs, what's lacking, what's working well, just really within the health and wellness realm. So I think 2 big takeaways from it. For one, just they all need just access to more information. Just getting, where do I go to get social services? And it's not to say we're not trying our hardest, everybody, but, it's just a good reminder that we still have avenues to work down to try and reach people who need access to this information. So it was both social service information as well as information around particular health topics and health concerns. One health concern that came up a lot was dementia, and really trying the challenges of that is it's very difficult to know how to navigate that disease. So any more information we can provide, that was one of the health issues, as well as just stroke and diabetes, some other general chronic health issues. So I feel like we had a really full, robust hour-long discussion, and the goal now is to have our May meeting for health and wellness, May 16th at noon, in person for anyone who wants to join. And we're gonna really talk through those notes and those, what we took away from that, and come up with some action steps. Because I think that's the most valuable piece is, how can we actually, act on or think about what we've heard from these community members. So, Tasha, anything else that you want to add?
No, I think you covered it all. Thanks, Kate.
Kate, I want to make sure, thank you for mentioning that, our agency, Rachel and Tanae and Helen, there is a May 6th. Isn't that the benefits enrollment, or is it an outreach event? Remind me, I'm a little foggy.
No, you're right. Yeah. And I was gonna add that I think the benefits fair, we can share the flyer.
We did. It's already been sent. It came up during that.
Oh, good.
Discussion in April. It's been sent out to the group that was on that call, including Pastor Harcum. So I'm hoping that gets further distributed.
They were gonna put that in their bulletin.
Yes, exactly. So you're right on point, Maimuna. Yeah, to get that out the door. And we included actually several follow-up pieces that came up during that conversation. One of them being the community benefits.
Thank you for that. The other thing I wanted to mention. Thank you, Maimuna. The other thing I wanted to mention is our Adult Day program has been working with libraries and for a memory cafe. So there's been a memory cafe that's hosted at Central Library that expanded, and thanks to Jennifer Collins and in partnership with Parks and Recreation, there's now one at the Walter Reed Community Center as well, which is where the Adult Day program is housed. But that's also, we wanted to make sure there's one in South Arlington as well. So we can share the flyer as a follow-up, but that's open for individuals who are experiencing dementia as well as caregivers.
Great.
So on that note, are these, the benefit, fair and, the memory cafe, are these also sent out to civic associations?
No, because I think the challenge is that we do have some contacts through our communications office, but I think a lot of the civic associations have their own listservs and things, but we do have some outreach channels.
Yeah, I tried to keep the Alliance Citizens Association updated on all the activities that is announced at our meetings.
Thank you.
Yeah, Peggy's association is very active, so there are a lot that are active out there, and
Yeah.
I know the county has some sort of, well, these are creatures of the county, so there should be some sort of liaison at the county, I would think.
Yeah, like the weekly newsletters, sometimes we can get the plugs in there.
Super.
If we go on your website, will we find this information?
That is a good question.
Where would I, just like you just mentioned, that there was a flyer and.
The community benefits flyer.
uh,
Community benefits.
Yeah.
Fair.
We do have a page dedicated to the Benefits Enrollment Center.
Okay.
But to be very honest and transparent, our website, the county website is not easy to navigate.
No, it isn't.
Yeah, we are working to try and make it more user friendly as well. But we do have a site dedicated to the Benefits Enrollment Center. I don't think we have the Memory Cafe. And actually, we do. I think we, yeah,
We do have a flyer.
yeah.
Yeah, it's in the material, we do have a flyer.
Thank you.
Okay.
Oh, but we're on it this morning. Even if it was sent out on
It's
both.
in the material.
Yeah, it's in the material that was distributed. And,
Yeah.
and also, on an information note, is you can sign up for various newsletters that the county puts out. I signed up for, I think, way too many, but I signed up for DHS and I signed up for one for Lycan. And I get those pretty frequently, and it's all of this information that you're talking about is in there. So you can sign up other groups if you want to receive it, but I strongly encourage members of the commission to sign up for them, because it is a way of getting that information.
Sure. Well, thank you for doing that. Yeah, we need to get the word out there, you know, as Health and Wellness found out, to get to everyone who needs information. So I think we're doing well on time. Do we have any liaisons that want to provide any updates?
Michael Schuster.
Yeah,
Michael, you want to get? Go ahead.
yeah, can you hear me? Yeah, this is Alexandria, Michael Schuster. Just two things. On May 13th, we have our Excellence in Aging Awards, which will be co-presented with the Mayor Gaskins of Alexandria City. And then on May 17th, we're going to have a proclamation in the City Council that would recognize May as Older Americans Act Month. With the theme is going to be flip the script on how we talk about aging. So I put something in the chat. So if you want more information, you can just email me later. But that's it from Alexandria.
Okay, thank you, Michael.
Thank you.
Do we have any other liaisons?
Just a quick note that Cynthia and I did meet, it was before one of her trips. She was traveling, you know, to kind of talk about where things stand and, because we haven't had an age-friendly Arlington meeting in quite a while. We've also been talking about how we can best consolidate progress on the action plan moving forward, since we are 2 years into the plan now, almost. So that's kind of in the works, and yeah, maybe the next meeting we can talk more about that.
All right, thank you, Kathy. Any other liaison updates? Okay, well, thanks everyone for keeping us on track. Do we have any old business, new business announcements? You know, as Roland noted, we have Carlos, you know, nearing the end of his term, and that would make 2 vacancies. So please, get the word out to your friends and family. And on that note, I will also reach out to our newer members to see, you know, what their experience is like and what we can do better or different. So be on the lookout for that. And unless there's anything else new, thank you all so much, and hope you have a great rest of your day.
I just want to thank you for listening in to our Citizens Association.
Yes, ma'am.
How did you do? I mean.
Well, you know, one of the sidewalks that we need to improve is around the Langston Center. And so I think it'd be great if we could perhaps chat with one of the next meetings to see how you all want to take action.
Oh, okay.
Yeah.
All right. Thank you.
Thanks, everyone.
Thank you, everyone. Bye-bye.